The girls want an L&D video from a nursing perspective. I got you. Nursianas, come into the room. Nurse for almost 8 years. I started off in the ED, then went behavioral health, geri psych, then went ICU, then went labor and delivery. So I've done all the specialties. I've always been a specialty nurse, period. Labor and delivery has always been like a passion and what I always wanted to do. Knew that from the jump. From a nursing perspective, if I can relate the specialty to any other specialty, L&D is the emergency room for pregnant people. So if you don't like ED, you're not gonna like L&D probably. But you may, because even though we're like the emergency room, L&D is specialized. So you know these are the things that we're gonna see. Labor intensive, but it's so rewarding. Cause I tell people, you never forget the first time you get married and you have your first baby. So the fact that we get to be there for one of those special moments like makes all the difference. And it's also very rewarding. But again, it's labor intensive. So you can push with like a first time mom for up to 4 hours. Okay, we can get 10 centimeters dilated, push for 4 hours, don't make any movement on baby. Then we're back to, the back for a non-emergent C-section. Okay, that's another hour and a half on your feet. So, you may be standing a lot of your shift. Charting can be intensive too. Of course, if your mommy is on like Pitocin or something like that and the facility requires like Q15, fetal heart tones and strips and stuff. So you can be charting every 15 minutes, sometimes the entire shift. Other than that, it's labor and delivery is like emergency room and psych all together. And that's no shade to our patients because it's a lot mentally going on. I'm trying to push a human being out of my body. So it's almost like you have to know the rhythm of emergency because things escalate very quickly in L&D or things can deteriorate very quickly in L&D. But I also have to remain in the perspective that my patient is counting on me to be stable mentally so I can help her zone in and hone in on this moment and to basically coach her through. L&D nurses were coaches. I'm coaching you through birthing your baby, which means I have to be of level mind and encourage you to be of level mind in the most unorthodox, insane, booty in the air, lip flapping, side to side. L&D is psych and emergency room mixed together. If you don't like psych and you don't like emergency room, it may not be a specialty for you, okay? So yeah, we deal with a lot of emotions and a lot of beautiful, sometimes emergent situations.